Welcome to Advocacy in Nursing, Empowering Your Patients. In this video, we'll explore the crucial role of advocacy in nursing and how it can empower your patients. So, what is nursing advocacy? At its core, it's the commitment to standing up for the rights and best interests of your patients, whether ensuring their voices are heard or guaranteeing they receive the best possible care. Advocacy is a fundamental aspect of nursing practice. But why is advocacy so important in nursing? Advocacy not only protects and promotes the rights of individuals, but also fosters trust, builds strong patient nurse relationships, and ultimately leads to better patient outcomes. Throughout this video, we'll delve deeper into the various dimensions of nursing advocacy. We'll discuss the challenges nurses face, the impact of overcoming these obstacles, and provide practical steps to become effective advocates for your patients. By understanding and embracing your role as an advocate, you can significantly influence patient care and outcomes. Remember, advocacy isn't just a duty, it's an essential expression of our commitment to patient-centered care. It's time to empower yourself to be the change your patients need. As we move forward, you'll see how vital advocacy is and how you can start integrating it into your daily practice. In this segment, we delve into the importance of advocacy. Advocacy is a cornerstone of effective nursing, with far-reaching impacts on patient outcomes and overall care quality. By stepping into a strong advocacy role, nurses foster trust and rapport with their patients. Why is advocacy so essential in nursing? A nurse who advocates decisively for their patient can influence positive health outcomes. When patients feel heard and understood, their confidence in the healthcare system grows. This trust is built through consistent and compassionate advocacy, forming a bedrock of reliable and empathetic care. Moreover, strong advocacy is beneficial for patients and crucial for nurses. It reinforces the core values of nursing, reminding healthcare professionals of their vital role in patient care. As advocates, nurses bridge the gap between patients and the complex healthcare environment, ensuring every voice is heard and every need is met. As we move forward, you'll discover more about the challenges in nursing advocacy and how to overcome them. Up next, we explore the common barriers nurses face and why addressing these obstacles is essential. Despite its significance, nursing advocacy is not without its hurdles. Nurses often navigate a complex landscape filled with obstacles. Common challenges include limited time, insufficient resources, and overwhelming caseloads, making effective advocacy a daunting task. Systemic barriers, such as administrative policies and institutional constraints, can further complicate their efforts, impeding nurses' ability to act as powerful patient advocates, risking the quality of care and patient outcomes. Understanding these challenges is the first step toward finding solutions. As we delve into these hurdles, it's important to acknowledge that they are not insurmountable. By identifying and addressing these barriers, nurses can become more effective advocates. Let's look at these challenges closely and dissect the root causes that impede effective advocacy. As we move forward, you'll see that with awareness and strategic action, these obstacles can be overcome, paving the way for more empowered nursing practice. When advocacy challenges are left unaddressed, they can have serious and far-reaching consequences. Negative outcomes often arise due to insufficient support systems, eroding trust between nurses and patients. Imagine working tirelessly but still failing to meet your patient's needs. It's incredibly disheartening, impacting overall patient care and morale within healthcare teams. As these challenges persist, they ripen conditions for miscommunication, unmet expectations, and even preventable medical errors. As we tackle these advocacy obstacles head-on, we must remember the stakes involved. Ensuring every nurse is empowered and knowledgeable about effective advocacy isn't just beneficial but essential. In the next segment, we'll explore practical solutions to overcome these challenges and enhance your role as a patient advocate. Stay with us as we turn the tide from adversity to empowerment, providing you the tools to make a significant difference. Now, let's look at some practical solutions to overcome these challenges and empower you as a nurse advocate. As a nurse, you have a unique opportunity to profoundly impact. By implementing these strategies, you can ensure that your advocacy efforts are effective and empowering. First, let's talk about the significance of staying informed. Continuous education is vital in keeping up to date with the latest practices and policies that affect patient care. Another crucial solution is building strong relationships with your patients. Trust and effective communication can significantly enhance your ability to advocate for them. It's equally important to understand each patient's individual needs. Active listening and providing personalized care are fundamental components of effective advocacy. Collaboration with the healthcare team is also essential. Working together with colleagues from different disciplines can help you address your patients' needs more comprehensively. Furthermore, empowering your patients by educating them and encouraging self-advocacy fosters independence and confidence. This enables them to take an active role in their healthcare decisions. Finally, remember the value of advocating for policy changes. By influencing healthcare policies, you can contribute to systemic improvements that benefit all patients. As we move forward, you'll see how these steps can be integrated into your daily practice to create lasting, positive changes in patient care. The first step in becoming an effective nurse advocate begins with educating yourself. As healthcare continuously evolves, it's vital to stay informed about the latest research, policies, and best practices. This isn't just a one-time effort, but an ongoing commitment to continuous learning. By keeping up with advancements in nursing and patient care, you equip yourself with the knowledge needed to support your patients better. Engaging in professional development activities, attending workshops, and being part of nursing organizations are all excellent ways to maintain your knowledge. Remember, the more educated you are, the more effectively you can advocate for your patients' needs. As we move forward, you'll see how building strong relationships and understanding patient needs play a crucial role in advocacy. Step 2 is about building strong relationships with your patients. Trust and rapport form the foundation of effective advocacy. Every interaction is an opportunity to create these bonds. By fostering trust, you lay the groundwork for meaningful communication. Effective communication isn't just about talking. It's about listening and understanding your patient's needs, fears, and hopes. When patients know they can rely on you, they are more likely to share vital information that can significantly impact their care. This trust becomes a bridge, connecting their concerns with the appropriate solutions. Remember, strong relationships aren't built overnight. It's a continual process of showing empathy, being present, and consistently communicating with clarity and compassion. These relationships empower both you and your patients, creating a collaborative environment where patient welfare is the priority. As we move forward, you'll discover the next crucial step in empowering your patients through effective advocacy. To advocate effectively, you must understand your patient's needs. This begins with practicing active listening. It's more than just hearing words. It's about truly understanding the emotions and concerns behind them. By taking the time to listen actively, you gain invaluable insights into each patient's unique experiences and preferences. This foundation helps you provide care that's tailored to their specific needs. Personalized care isn't a one-size-fits-all approach. It's about crafting a plan that fits the individual rather than forcing the individual to fit the plan. By prioritizing active listening and personalized care, you not only address the immediate needs, but also build deeper trust with your patients. This empowers them, making them feel valued and understood. Remember, every patient is unique, and your advocacy should reflect that uniqueness. As we move forward, you'll see how collaboration with the healthcare team can further enhance patient advocacy. Step 4 is all about collaboration. In nursing advocacy, working closely with the healthcare team is essential. Effective teamwork and interdisciplinary collaboration greatly enhance our ability to advocate for our patients. Each member of the team, from doctors to therapists, brings unique insights and skills that help create comprehensive care plans catering to the holistic needs of patients. It's through this collective effort that we can provide the highest level of care and support, ensuring every voice is heard and every concern is addressed. Remember, as a nurse advocate, you are not working in isolation. You are part of a larger framework, and leveraging that network is key. As we move forward, you'll see how empowering patients to advocate for themselves can make a significant impact. Empowering your patients begins with education. By providing them with the necessary information, you enable them to make informed decisions about their health. As you do this, encourage your patients to be their advocates. This is crucial for fostering independence and building their confidence. Empowered patients feel more in control of their care, which can lead to better health outcomes. Remember, when patients understand their conditions and treatment options, they can engage more effectively with their healthcare team. Take the time to educate, listen, and support. Your role is instrumental in helping patients navigate their healthcare journeys. As we move into our next step, we'll explore how nurses can advocate for policy changes to improve the healthcare system at large. Advocacy is a powerful tool that extends beyond the bedside. In Step 6, we focus on the importance of advocating for policy changes. Nurses have a unique perspective that positions them to identify gaps and inequities within healthcare systems. By engaging in policy advocacy, you can drive systemic changes that improve patient care on a broader scale. This means stepping into roles where you can influence legislation, participate in advisory boards, and join professional organizations committed to healthcare reform. Your voice can shape policies that ensure better resources, safer environments, and more efficient healthcare processes. As we continue our journey, we'll explore how these larger-scale efforts complement our hands-on patient advocacy. Together, these steps can lead to a more equitable and effective healthcare system. Let's move forward and see how you can reflect on these efforts to continually improve your advocacy practice. As an advocate, the journey doesn't end once you've implemented your strategies. It's vital to step back and reflect on your efforts. Self-reflection allows you to assess what worked and what didn't, offering valuable insights into your practice. Continuous improvement is about striving to be better each day. This means seeking feedback from peers, staying updated with new advocacy approaches, and adapting to the ever-evolving healthcare landscape. Through reflective practice, you identify strengths to build on and areas needing enhancement. Always remember, the goal is to ensure you remain an effective advocate for your patients. Advocacy is not a static role. It evolves, and so should you. Take time to pause, analyze, and grow from your experiences. This journey of continuous improvement not only enhances your skills, but also profoundly impacts patient care. As we move forward, you'll see how these reflections shape real-life success stories in advocacy. Let's look at some real-life success stories of nurses who have made a significant impact through advocacy. Meet Sarah, a dedicated nurse who recognized a serious medication error about to occur. Her quick thinking and firm advocacy for her patient not only prevented a potentially fatal mistake, but also led to improved medication protocols in her hospital, ensuring safer practices for all. Then there's Michael, whose unwavering support helped a patient navigate the complex web of cancer treatment options. By serving as a constant advocate, Michael empowered his patient to make informed decisions, resulting in a treatment plan that saved her life. Consider the story of Emma, who championed policy changes within her healthcare setting. Her efforts brought significant improvements in nurse-to-patient ratios, dramatically enhancing the quality of care provided. These inspiring examples show that effective advocacy can lead to profound, positive changes in patient care and the healthcare system at large. As we move forward, you'll see more strategies and steps to help you become a successful nurse advocate, like Sarah, Michael, and Emma. To recap, we've journeyed through the essential aspects of advocacy in nursing, uncovering the profound impact on patient outcomes. We've identified the challenges nurses often encounter, from practical barriers to systemic issues. Most importantly, we've explored actionable steps to empower your patients, starting with self-education and extending to policy advocacy. These steps include building strong relationships, understanding individual patient needs, collaborating within the healthcare team, and encouraging patients to advocate for themselves. Throughout, we've seen real-life stories showcasing the powerful difference effective advocacy can make. As we conclude, remember that each small step you take toward better advocacy can lead to significant positive changes for your patients. Let's stay dedicated to this journey of empowerment and continue to refine our advocacy skills for the betterment of those we serve. Stay tuned for our final thoughts and actionable next steps. You've seen the steps, understood the challenges, and witnessed real-life success stories. Now it's your turn. Take these steps and become a powerful advocate for your patients. Remember, every effort you make can transform lives. Don't stop here. Continue to educate yourself, build meaningful relationships, and understand your patients' needs. Collaborate with your healthcare team, empower your patients, and don't shy away from advocating for policy changes. Reflect on your practice and always strive for improvement. For more resources and detailed guides, check the links in the description. Together, we can make a difference, one patient at a time. Thank you for dedicating your time and passion to caregiving and for being the change our healthcare system needs. As you take this journey, remember, you have the power to be a voice for your patients. Stay informed, connected, and empowered. Let's transform patient care through the art of advocacy. Thank you for watching Advocacy in Nursing, Empowering Your Patients. We look forward to seeing the incredible impact you'll make.